Hi guys, welcome back to my channel. My name is Monica Macrin. If you're new here, please subscribe to this channel, and if this is not your first time coming to this channel, welcome back again. I appreciate you supporting this channel, but please make sure you like this video so that you can help expose my channel more. When you like this video, the YouTube algorithm is going to be like, oh, people like this video, so let me advertise it more for this girl, and you're going to be supporting my channel. So this video is a follow-up to the previous video that I did a video on things that you should consider before choosing a normal delivery. So for this video, I want to tell you about things that you should consider before choosing a cesarean section. Again, this might be, but I feel like this is not going to be more controversial because most people demonize a cesarean section, and that is what I'm sort of going to do. I'm going to be talking about the side effects that people should know of before choosing a cesarean section, because I feel like when I was talking about a normal delivery, I was mostly talking about how people rush into trying to convince women to choose normal delivery simply because it's easy and you deliver easily and you don't get things like back pains. So for this video, I'm talking to those people who just jump into, okay, me just want to go for a cesarean section because it's the safest, because it is painless. So I want you, before you choose to go for a cesarean section because of those ideas like it's easy, it's painless, it's easy to recover, I would also want you to take into account that there are things like the scar might not heal well. We've had instances where moms have to go back to theater. Surgeries are special. There's a friend of mine who once told me surgeries are special, and indeed surgeries are special. You can't control what is going to happen to you in the theater, so shit can hit the fan. So when you're going, and this is the case for every delivery, even normal delivery, shit can hit the fan. So even for CS, shit can hit the fan. So when you're choosing it, just know that surgeries are special, and even if you have the best surgeons in the theater, they're not always in control. Things, there is the anesthesia. Probably you don't know if you're going to react to it. You do not know, maybe someone might, puncture the wrong places. And also, there are so many things that could go wrong in a surgery, so it's important for you to know that. Then post-surgery, you're supposed to know that there are things like the side effects of anesthesia. Some people talk and they spill out all their secrets. Some people, like myself, you start itching. I remember I had an itchy skin for like 3 days, and that is neither here nor there compared to other side effects of a CS. And then there's also the instances where moms experience terrible back pains afterwards. So yeah, even in a cesarean section, you can experience terrible back pains, which can go on and on and on. But one thing I usually tell people is that every back pain after delivery should be able to go away after 3 months. If that is not the case, please go to any rehabilitation center. Maybe go see a physiotherapist, go see an exercise physiologist. We have chiropractics. So yeah, there are so many. In short, do not die alone with your back pains. They can be sorted. Another thing I would like for you to know about a cesarean section, yes, you could also suffer postpartum depression from the CS, because for some people they fear the theater. Probably for me, I had been in theaters before, not as a patient, but I kind of knew what to expect. But I have a solution for you, because I believe that most people usually feel traumatized because they do not know what is expected of them in the theater, and they do not know what to expect once in the theater. So I'm going to make a video showing you, rather telling you things that you're supposed to expect once inside the theater, so that probably after knowing what you're supposed to expect, then it's going to be less scary. But nevertheless, simply because it's a surgery and it's a theater, and those are like big words to an ordinary person, it could trigger postpartum depression. So apart from the fact that surgeries are special and anything can go bad, the issue of back pains, then the issue of postpartum depression, and then there's this the issue of side effects of the anesthesia. And by the way, there are some people who do not actually get like completely numb, and they feel the pain through the surgery. And mostly people who take a lot of alcohol and weed, that is very common. So if you take a lot of weed, a lot of alcohol, if you're planning to get pregnant, probably should wean yourself off, because you could actually feel the pain despite you being under the anesthesia. Then another thing I would want you to know before considering a cesarean section is that wounds do not heal the same for every person, and there's also the likelihood of getting an infection, and an infection after a cesarean section can be very serious because this is the wound that comes from the uterus. There are so many layers that are usually cut as the baby is being removed, so this is an infection that goes inside and it can be very, very, very bad. So it's important that you know that if you do not take good care, if your hygiene is not up to up there when you're taking care of your CS wound, things can go bad. Unlike for normal delivery, yes, I know, and especially a normal delivery where there was no episiotomy, if you are just not clean, the risk of getting an infection is lower. But when it's a cesarean section and you're not clean, things are likely to be bad for you. Also, for the healing of the scars, some people can have hypertrophic skins. You could have keloids. So some people, the scar is very neat, but for other people, there's that, the skin, you might form keloids, you might have scar tissues. But then again, there are things that you can do to prevent the formation of hypertrophic skins and also the occurrence of keloids, and I'm also going to do them in that video that I have promised to show you about things that you should know, the things that you should expect inside a theater. I feel like I have exhausted most of the things that I feel like you should know before going for theater, before you going to theater, before choosing to go for a cesarean section. Let me see, have I forgotten something? You should also know that the risks of you getting hemorrhoids is higher when you go through a cesarean section, and they are not comfortable. They're not comfortable. I went through them, but then again, you know me, I'm going to plug you with another video telling you how you can be able to prevent these hemorrhoids. But yeah, coughing and laughing is not easy after a CS, because when you cough and you laugh, you feel like things are going to tear apart. So for like 2 weeks or a month after that, you might not feel like yourself, but then again, it could be the same for normal delivery. So yeah, I just wanted to know that even if you're going for a cesarean section because you feel like it's safest and painless, it's not entirely true. So basically, when I'm making these videos, I want us to be able to make these decisions mostly out of what do I want as a woman, and also from the point of what is medically safe for me. Okay, yes. So yeah. I have a feeling like there's some points that I haven't discussed in this video, but then again, I'm talking not from a medical point, but I'm talking as a woman who has gone through a cesarean section. But I'm inviting women who have gone through a CS, and maybe it wasn't a cup of, not really a cup of tea. I want to say that it wasn't easy or it was traumatic. I want you to kindly comment at the comment section so that other people will be able to read. Yes, so please, if you've gone through a CS or you've seen someone who has gone through a CS that went bad, please make sure that you comment here. But honestly though, if you're choosing to go through a CS and not, maybe it wasn't an emergency, invest, save, make sure that you go to a good hospital. Make sure you go to a hospital with a good theater. And I did a video telling you about reviewing some hospitals in Nairobi that are really good. So don't just go to those hospitals, uko chini for two, and you don't even know if the person who is doing that surgery is a gynecologist, someone who is experienced. So if you're doing this out of choice and not like medical reasons, just do yourself that favor. Make sure that you save up and you go to a good hospital. Yep. Until next time, it's a girl, Monique McCreen. And if you've come this far, please make sure that you subscribe and that you like this video.